first of all, why you want to talk to me, what happened at the doctor's place, and then some specifics there. So can you give me a little background?
I broke my upper arm, my humerus, near the shoulder, and there was a freak accident at home, and I went to an orthopedic clinic, saw a doctor, and then when it came time to go to physical therapy, I had been to a private clinic previously when I had hurt my back several years before and had liked their work. But I asked him about that, and he said, well, he didn't know them and would have to find out whether they were competent and all that. But they had a physical therapy clinic at the orthopedic center right there.
And this was the doctor's physical therapy?
The doctor's physical therapy clinic.
I see.
And so he really would prefer if I went there. Being as this was the first time I'd ever broken a bone, I conceded and went to that clinic. The first time you go to one of these clinics, you're in a private room and you see the physical therapist for the whole 45 minutes or whatever. But then the next time I went, I'm out on a table along with 4 or 5 other people in a little area, and I'm only with him for maybe 15 or 20 minutes at the most. And then he takes me over to a table where I do some slides with my arm and, shows me some different things, and then I'm just there by myself. So I, did that. And then at the end, I think they use this electronic stimulation. But basically, you only see the therapist for 15 or 20 minutes. Then I went back again, and I saw him, he was the manager of the department for several weeks, maybe a week or two, I guess, 3 times a week. But then I was having trouble getting scheduled with him, so they were scheduling me with someone else who ended up being a physical therapy assistant.
You said you had been there for a week or two, and then what happened?
I started having trouble scheduling appointments with the head of the physical therapy department, so I was having to schedule with another person there who was only a physical therapy assistant. And again, I would spend 15 or 20 minutes with her, and then I would be put off onto the exercise equipment.
And were you there by yourself?
Basically. I mean, they kind of show you how it's supposed to be done, but then they're off doing something else.
Okay. So you were not supervised then, is what you were telling me?
No. I mean, they're sitting within, I guess they can see me, but they're not looking.
Okay.
I mean, they're, just doing something else on the computer.
Okay, good.
And then one time I was given to an intern, and she was only supervised by the physician's assistant, not by a physical therapist.
Okay, so when you say, was it an intern or like an aide or a technician?
No, an intern.
Like a physical therapy student?
Student, yes, student. And I guess I was not too pleased with the treatment. And I didn't feel that she was really supervised. And she was not being supervised by a physical therapist, but only by an assistant. And I asked about that, and they said, well, as long as she's within seeing of someone, she's okay. And I thought, well, that's not really the way it should be. If she's supervised, the supervisor should be right there, critiquing what she's doing. Quite a few times I felt like the exercises needed some assistance to show exactly how they should be done, because some exercises, it makes a difference whether your hand is turned up or down, or, different things like that can make a difference. I wasn't getting that kind of direction. And there was another time when they gave me an exercise to do, and I remembered later, I wondered why I was sore, because the doctor had said, don't do exercises that stress this particular way of doing things because of the way my fracture was. He didn't want it to where I would push the arm back, I guess is what it would be. And one of the exercises they gave me was doing that. And I just got the feeling that they really, either they didn't talk to the doctor or he never talked to them, or, there just wasn't much communication.
So the doctor was never there when you were doing physical therapy? You never saw the doctor during?
Never saw the doctor once. And finally, after I think probably 2 months of this, I decided to go to my private practice physical therapist and stop going to the doctor's physical therapist. And I think the private practice physical therapist wanted to talk to the doctor about the injury because looking at the x-rays, it really did not appear that it was healed. The break was healed because it was not filled in. It wasn't closed in.
Mm-hmm.
It was a spiral break. And the physical therapist wanted to talk to the doctor and tried calling, but all she got was his assistant, and that was it. I ended up going to a doctor that she referred me, my private practice physical therapist referred me to, because he would talk to her and discuss the situation and collaborate on the care, where the other one was not really, didn't seem interested in doing that.
So I'm just going to summarize. Number one, during those first visits with the therapist, you were seen by that therapist maybe 15 or 20 minutes, and that was about it. And then that therapist would show you some things to do and then would not supervise those exercises, correct?
That's correct.
Okay. And then when you were scheduled with the assistant would show you how to do exercises and then would be off doing something else or working with other patients and was not supervising your treatment then either. Is that correct?
Yeah. Occasionally they might pass by,
okay.
But that wasn't necessarily every time.
Okay. And then the next thing you mentioned to me, you said that there was a student intern, physical therapist, not a physical therapy assistant, but a physical therapist, student intern, that was guiding you with your treatment program, but was being supervised by a physical therapy assistant, correct?
Right.
Okay.
That's correct.
Okay. And then you told me that the communication between the physical therapist at this physician-owned physical therapy practice was not good with the doctor, and you didn't feel that they were communicating with each other correctly. Is that right?
That's correct.
And then, therefore, the communication was poor between the physical therapist and the doctor that this physical therapist worked for, so you decided to go to an outside physical therapy practice that you had been to previously that the doctor said he didn't know if they were competent at treating humeral fractures. Is that correct?
That's correct.
Okay, and when you went to that private practice and you worked with that physical therapist in independent practice, that physical therapist took a look at your x-rays and tried to call your doctor that you had been to before, but could only get to the doctor's assistant and was unable to collaborate with the doctor. Is that correct?
Yeah. And
okay.
when I spoke to the doctor about the x-rays and the physical therapist looking at the x-rays, the doctor told me that physical therapists can't read x-rays.
Okay, that's fine. And then,
but I could look at it and tell myself that it wasn't healed.
I see. So when you went to this private practice physical therapist in turn referred you out to another orthopedic surgeon the therapist was able to collaborate with, and there was good communication with, and as a result of that collaboration, you continued your therapy with that physical therapist, the independent practitioner. Is that correct?
Right. That's
okay.
correct.
And how did you feel the treatment was at that private practice versus the treatment that you experienced in the physician-owned physical therapy clinic?
Oh, no, it's much better. And I experienced quite an improvement the first, week or so after I went.
Was the doctor ever there to supervise your treatment at the physician-owned physical therapy practice?
Never.
Never. Okay.
Never.
So you never saw the doctor while you were going to physical therapy in the physician's
Never.
practice? Okay.
Never. The whole time that I was there in that clinic, I never saw a doctor, period.
So
any doctor.
How many doctors were at this in this
Probably
physician practice?
A dozen.
So there were a dozen
more.
doctors in this orthopedic
Yes.
practice that had physical therapy, but you never saw any one of the doctors in the clinic ever?
No.
Okay, I think those are all my questions. Is there anything else you'd like to add to our conversation?
When I went to the second doctor, basically the treatment that I received from the doctor was the recommended treatment would have been the same by the second doctor that I saw. So I don't really have a problem with, what he did, whether he chose surgery or not chose surgery. I think that was okay that he didn't. But I just have my problems with referring to their clinic there instead of, kind of pushing me toward that rather than saying, yes, it's okay to go someplace else. He didn't force me or anything, but when you don't know exactly what qualifications are when it comes to broken bones or otherwise, you kind of, well, okay, listen to your physician.
Yeah, my follow-up question would be, when you go to your physician and your physician makes recommendations to do something based on your condition, would you say you follow the physician's instructions and recommendations?
Most of the time, yeah. I mean, I listen. If it's something that I strongly disagree with, I might
seek a second opinion, or
yeah. But in this case, I thought, well, they do deal with, broken bones, so maybe they do know better. So I just thought, well, okay, I'll give it a try. But I learned.
And when you went to this private practice, did you find that this private practice was equally well equipped to deal with fractures of the humerus like you had?
Yeah. I think they were better equipped to deal with that.